very often because they ask me to work the other benches. But I usually will put mine numerical order starting down here and then going up because I'm a little bit shorter. So these are number 1. These are your cassette / mold warmers. Number 2 is your cooling plate or your cryo console, which is this guy. A trick of the trade is you spray alcohol on here. This will help with the ice accumulation because since it's cold, a bunch of ice is going to start accumulating on here to help with your molds. So we spray it with an alcohol. It can be any percentage of alcohol as long as there's alcohol in there. It just depends on if we had time to fill it with 70 or 80%, or if we only had 100% on hand, which is fine. Let's see, number 3, your cold plate / your cold spot. This is going to be it right here too. You'll notice that there's some condensation that builds up over it because when we haven't used it in a long time. We always keep our embedders on. Never touch these buttons up here. Don't ever touch them, okay? To turn on the different components of your cryostat, the heat will always stay on. And then we'll get into that once we get to the display panel, okay? But don't touch these because if you touch them, you're gonna make all of our wax become solid and you cannot embed that way, okay? Okay, so this is our cold plate / spot. Our paraffin warmer / paraffin chamber is up here. So this is where you're going to add solid paraffin or melted paraffin, depending on where you're going. And you're literally going to pour it in here. At the end of the quarter, what you guys are going to do is you guys are going to completely empty out this entire embedder, and we're going to clean the inside of it because a lot of debris will get in there from the paraffin pellets. Okay? So that is number 4, your paraffin warmer / paraffin chamber. Number 5 is your paraffin spout / dispenser. So if you turn it to the left, it locks it, so I can't dispense any paraffin. If I turn it towards the, if I turn it towards the right, then I can't dispense it. But if I turn it towards the left, you can dispense. And you can change how quickly it's dispensing. So do you see how as I keep turning it to the right, it starts doing less and less, but then when I go to the left, it's a lot more. So this is your paraffin spout / dispenser. Number 6 is your display panel. So on here, this is where you can change the heat. Don't change the heat. Don't do that to me. This is where you would turn on your cryo console. You would hit the snowflake right here where it says cryo. And look, it's going to tell you the temperatures. So when you're Taskmaster and you ask for the temperatures of the different embedders, you can look on here and it will tell you. You can turn on the light right here and you can change how bright it is. Okay? So that's nice. Not all embedders have this built in. Typically when you're at an embedding station, you'll have like 1 to 2 different lamps, one above right here and then one off to the side for you to like get in really close. If your lab is real fancy, they'll also have a magnifying glass that can be pulled downwards too. Most other ones just have magnifying glasses in drawers for you, which is fine too.
So on the screen, we only touch the cryo button and the light button?
That is correct. So remember, this is how you turn it off and on. So we just turned it off, and let's turn it on again. Usually, sorry, I should have pointed this out when I first turned it on. But usually when you turn on the cryo console, you can of course touch it to feel it, so you can feel that it's starting to get cold right now. But you can also literally hear it has like a little kick. So you'll get used to that. And you can kind of hear that it's humming too. So that's also how you would know if you didn't know to look right here.
In the twisty, the knob, section 5, right to close, left open, correct?
Yeah. So remember like the whole righty-tighty, lefty-loosey?
Yep.
That's 6. Number 7 is our hot plate. So these are our hot plates. All of these are hot. That's why it has this little symbol for you. These are all hot. As you can see, they're all 65, all matching. Okay, so you want to be very careful and not to leave just like your hand on here like this because you will burn yourself. It's going to take some time for you guys to get used to working with the paraffin because it's so warm. A lot of you are going to be like, oh, that's freaking hot. And you guys are gonna be getting annoyed and upset. You're gonna be fine. You're gonna get used to it. Oh, okay, perfect. But usually I will use these to orient my tissue before I start embedding it because I just like to make sure everything is good to go. Number 8 is going to be your forceps wells. We have some on this side and some on this side. I even put my tamp in one of them. So these are our forceps wells. It holds all our different forceps. I personally prefer the older embedder because the forceps wells hold much better. You'll notice with these ones you have to get the angle just right, otherwise it's going to pop and out because at the bottom it narrows. And if you were trying to clean one of these, which I always clean the embedder before I start embedding because people are just nasty, filthy, and disgusting and our patients deserve better, so I always clean it. So do you see, so this is the trick of the trade is you can take a Kim wipe, wrap it around your forceps like this, and then I'll clean my forceps wells like this before I start putting my forceps in there to clean. So I'm just literally doing a circle in there. You see? And it's just gross ink, but it's still, sometimes you will be surprised at the things you will find in here. I have found bits of specimen and then I send it to my supervisor, like I'll just text her and I'll be like, yeah, this is what I found in the embedder after so-and-so was embedding. I was like, I'm not trying to cause issues, but I was like, but this is affecting our patients because it was a nice sizable piece of tissue that was definitely diagnosable. And I usually don't call out my coworkers by name, but I was like, we also needed to tell her too because we had been having consistent issues with that, with this particular tech. And so my supervisor did also explicitly ask like, hey, since you're over at embedding sometimes like during the daytime, would you just look and see how clean or dirty the embedder is? Oh, yeah. I feel bad, but I usually do get put in those awkward situations where my boss is like, I think this is happening with our patient tissue, and it's becoming a really big problem, and then so they'll have me kind of dig through things. I don't like doing it, but it also, it's just because I'm pretty good at finding things because I'll go the extra mile and I'll clean things people don't want to clean.
Because you're an amazing person.
I am. I'm kidding.
She's so humble too.
But
Exactly.
But yeah, so this is your forceps wells. So when you clean like that, you can even take it further, and I will actually even clean like this as well too. And this really helps you get it to the little crevices. Like I have tiny fingers and tiny hands, but this is still hard for me to always reach my fingers in between. So you can clean just like that, okay? Okay,
That'll definitely be useful for me.
it will be useful.
Since the forceps is metal, does that mean we don't need plastic to clean this the surface of the embedding station?
No, we're not going to use plastic to clean it.
Oh,
Yeah. Okay, waste drawer slash waste paraffin or paraffin waste patch. So I'm going to scoot back real quick. Sorry, Keith. So this is going to be number 9. So as you can see, some of the students like to line it with paper towels so it catches in there, and then at the end of the day they can just go like this. I honestly never see this in industry. I don't know who taught them this trick. I think it was day cohort when they had gone on one of like their lab tours. I really don't care for this because I like it when it catches in the tray because it's very satisfying to just scoop it out with the chisel, and so that's my personal preference, and most people actually in industry like it too. Just gives you something fun to do throughout your day. But yeah, that is your introduction.
Beautiful.
When you're cleaning, so obviously you're going to use your forceps to clean your forceps wells and your hot plate, but you're also going to be going, in and you're going to wipe down the tops like this too. And at the end of the day, you're also going to make sure that this is shut, so that when you go like this, nothing dispenses. You're going to take a chisel and you're going to scrape off any excess paraffin that is, well, anywhere. So you'll clean up there, you'll start scraping off the ice right here too, and then there's going to be some paraffin right here as well too. You literally will just scrape everywhere,
It gets everywhere.
including down here. It gets everywhere. So that's why we also have gauze, so then you guys can just start start wiping down like this too, because just using the chisel is not going to be enough, okay? Super simple, super quick, super easy. You guys are not dismissed until I tell you when everything is clean, especially with Taskmaster. Again, as you know, you have all agreed and done the assignment for Taskmaster, so you all understand, and I don't need to re-explain that process to you, okay?
Question.
Yes.
While we're embedding today, would you also like us to practice orientating our tissues?
Oh, you should be. As you're doing your embedding, your, what is it, 20 for the
Yeah,
first
20.
one? As you embed your 20, you should always, anytime that you embed, you should always practice good orientation. Okay? Okay, next. Let's see. Okay, so also here are all of your tools. If you need extra tools, you can always go to the other side and see what other tools they have. But so we have paring knives, we have chisels, we've got razor blades. Be very careful, these are all rusty, and this one is also not even all the way in, and it's also rusty. You can use these forceps if you would like to. Most of the time students really would prefer to use these, and that's fine. Don't use this unless you're cleaning molds, otherwise you're going to be very upset. And that goes for this as well too. And this helps your blocks be relieved more from being inside the mold, because a lot of times you'll get incomplete adhesion because they just stick too well together. So we have this to spray on after we clean. A trick of the trade is you can use lotion or Vaseline to keep as much paraffin as possible off of your gloves. It doesn't really bother me too much, and a little goes a long way. So you literally just put it on as if you're putting actual lotion on. So what we're going to do now is let's respray. Okay, let's see.
Oh, that one.
Oh, that one's
Tiffany's.
Oh, that's too good, Grandpa. Okay, I'm just going to pull this one. Only one. Yeah, I'm going to take one of yours.
Okay.
Hey, it's the one I remember. It's perfect.
What's your tissue type? Is it nail?
Nails.
So look, I'm tearing open my bag like this very carefully. And there's two pieces, right?
Yes.
So normally I would obviously just grab the block or the cassette and see how many pieces, but it's washed off. So that's why I'm checking with E verbally. If you can't tell on your cassette, then you obviously just go get your gross log. But look, so you see I tore open the bag, and now I'm going to try to rest the bag up against here. What I'm going to do now is I'm going to get some paraffin. I like to do this. And then what I'll do is I'll go like this, and I'll start orienting on top of this. And it doesn't always work, especially with like thinner things like nails, but this just kind of gives you an idea of like, oh, I just check first, and if it falls over, I just let it fall over if it won't stay right up. This one's a little bit crooked, and that one's good. And then now I can throw this away. Okay? So now what I can do is now I'm going to grab my mold. Now I'm filling it up at the bottom. Now what I'm going to do is I'm going to grab my forceps. And do you see how I keep moving my forceps back and forth between using them and not using them? It's because you want your forceps to be nice and warm, okay? Yee.
Yeah.
Why'd you cut it like this?
I believe they did so with scissors.
Yeah.
Ah, okay. My bad, my bad. Okay, so now, stop moving. Oh, goodness. Sorry. It's like, so you know how you get like that clear part of your nail too? That's what's hanging off. Okay, but now I'm holding it between my forceps and I'm putting it at an angle and I'm slowly bringing it over. And do you see how the paraffin is cooling at the bottom?
Yep.
So I'm using that to act as sort of like a cement for my tissue, and I'm holding it down. And now I'm gonna go get my last piece. I'm gonna do the same exact process, and look, now I'm taking my left hand and sliding it back over to where it's gonna warm it up again. And now we'll go back over the cold spots.
No, you're good.
Okay? And that's how you do it. And do you see how I was double checking with my forceps too? Kind of like shaking the nail too to make sure that it's nicely latched in there. Now I'm going to take my cassette top, put it towards the right. And now I'm just going to tap to get rid of any bubbles. And then I fill it up. And then I put it in numerical order, left to right, top to bottom, just like you're reading a book.
Question.
Mm-hmm.
Before put the cassette onto the mold, if gut feeling tells they're not flush, they're not flat to the very bottom, can I reverse the step by warm the white paraffin back to the clear paraffin?
Mm-hmm. I'm gonna take one of Let's see how you gross. And you want to try to keep this one closed to help with the warmth. But let's show you guys with another piece of tissue. This one could probably go into one of the smaller ones, like one of the smaller molds. Let's see, do I have a baby? No, I don't. Somebody, actually, Coda, will you hand me one of the tiny ones?
Upper, yeah, no.
So I'm gonna let this sit in here for a little bit. Just a minute. And then I get really impatient, so then I just. But do you see how it warmed it up just enough where the center was warm enough and then everything else is still catching up? I get impatient, so then I just. I'm telling you, I'm very impatient when it comes to like doing this stuff. And so now what I'm gonna do is I'm gonna take this tissue and I'm gonna put it in here, but I'm gonna put it at a slight angle because thyroid actually can be pretty tough to cut because it's so dry. So I want to introduce it a little bit at a little. Okay, everybody look over here. So can you see I'm holding it with my forceps? Now watch how I drag it over to the cold. Oh. And then now I'm going to use this to tamp it down. Okay, I like to use my forceps because it gives me more control, but you also have this kind of tamp, which you could do very lightly, okay? And then you take your cassette top, put it on top. Ooh. Put it in there. Oh. Are you guys not compatible? No, they are. Just being stingy. But so now I have my cassette top on, and then I can get bubbles out by tapping it, or I can try another method. But this mold just doesn't fit quite right, so I'm going to just demonstrate that with a different one. And do you see how this is not flush up against it?
Mm-hmm.
We would want that flush up against it. And so I can just must be rust somewhere, sorry. But then I can just go like this. And this is Coda, so I'm actually going to move it down here. I don't want them to get mixed up.
Well, mine is labeled.
If can I? They don't have label.
I know.
But if
Oh,
you do it
shoot.
like that, I won't be
Dang
able
it.
to.
That one
Okay.
I know, the rest I don't.
Coda, I'm going to use yours as another example, okay?
Oh, please, go right ahead.
Thank you so much. Ah, not another nail. You've already seen nail. But so none of this is really all that hard.
You,
Do you have any skin?
I should have one in there, but I don't know the number off the top of my head.
Let's give your small biopsy.
My small biopsies are near the top.
I think the
Yeah,
I think
they
the
should
one
also say
was
small
much-
BX, like very clear.
Yep, small VX.
The orange one's the punch.
Is the punch?
The orange one is the punch. That is
Okay,
correct.
perfect. Will you go get me stuff for this, like to make a scalpel? Real quick? And I won't start without you, I promise, in exchange for your efforts.
Everything gets everywhere.
Oh, yeah, it literally just gets everywhere.
So, back to these cleaning sprays. Are all of those the same? Those spray bottles, those are all the.
They're not for cleaning.
No, I know, but they're for the molds only, correct?
Mm-hmm.
So don't use those on anything else.
Oh. Oh, no, don't stick.
Alright.
Yeah. So now I'm going to switch out one of these. We actually would not want to use a giant one like this. I should have specified, my bad. That's okay.
For the
that's fine.
future.
For the future.
So you're using which tissue type is this? The small.
We're getting there. It's got to warm up first.
When you say the giant scalpel, you mean the blade
No,
large?
the
or
handle.
The handle large.
Yeah.
Okay.
Okay, so right now we're going to embed this small biopsy. So some people will put their cassette tops to the side to count how many pieces, or to count, no, sorry, not how many pieces, to count how many cassettes they have embedded. You guys can do that, but it's also okay not to do that. Okay, so again, we're going to do the same process.
Oh, can I in between?
Are you recording?
Yeah.
Takes that after.
Yeah.
Three. So do you see how I'm orienting them already? In this tissue, these small biopsies, these are honestly pretty big. So
Yeah.
they have a lot of depth to them. And it's only, what is your tissue type? Stomach? Stomach's going to look the same regardless of which side you put it on. So this can just be embedded flat. Because it's, actually you tell me, what are the reasons why? What were the reasons I just said? Why can it be embedded this way?
Because it looks the same. Oh, I just had this just
Yeah. Stomach.
That's one reason.
That's one reason.
What's another reason? There's one more reason.
But
They're all from the same wall,
Yes.
right?
Dang, you guys are good. Look at you. So.
Wait,
I
what's the answer again? It's from the same wall, right?
Yeah. So
Oh,
no,
that's it?
it's stomach. It's stomach. So stomach is gonna look the same regardless of which side you flip it on. That's gonna be the same with like all GIs that you get. It's gonna look the same. So it's okay to embed it flat, and then it could be embedded flat too because this is pretty big. This is a lot of depth that you're giving. If this tissue was super thin, I wouldn't embed it like, let's take this one for example. Like say it was really thin. Instead of embedding it flat like this, I would actually pick it up and I would put it on edge so that it could be standing up, and then that gives the embedder even more tissue. So if these, even as stomach biopsies, if they were smaller, if they were thinner, I would stand them up on edge like this. Okay?
Because we want to give the embedder or the cutter as much tissue as possible to cut.
Yeah. That's true.
Oh my, the eyeball is
So
gonna
you
be.
can stand them all up.
use them. Use an eyeball.
So you can see how all three of these are now standing up right now. So I can embed it like this too.
So when orienting, we want to make sure that it has the most possible tissue to cut?
I mean, yes. So like with skin shaves are like, think of like a piece of paper. It can be like that thin. And so obviously if you have a piece of paper like this, and it's just like this, we're not getting a lot from this. You're gonna exhaust that right away.
Right.
But if you stand it up like this, it's like, oh my God, we have so much to this now. But we can also see the different layers. We can see the keratinizing layer, the epidermis, the dermis, the subcutaneous fat sometimes. We're getting there. You're okay. I don't want to show you today, like with a skin practice block, but I probably will show you guys next week. But so let's say I was embedding this on edge. So I'm gonna go like this. So you remember how I was doing it earlier? I was doing one piece. Now I'm just gonna go one by one, and that's where this trick comes in handy, where part of it is on the cold and part of it's on the hot. So that it gives me enough time to go back and forth and back and forth and back and forth. And actually, oh my God, this mold's too big. This doesn't make any sense. So now we're gonna go find another mold. So you see here, I was tying in what you were asking about, where you're like, can I go back?
Mm-hmm.
You can absolutely go back. So all I have to do is this, and that's it. Now I can take one of these. Obviously, if you have a bunch of debris in here, you don't want to put it back in here and use it with something else. If this had a bunch of debris in it, then I would just call it a day. But let's keep moving on. So you want to use a decent sized mold that's going to give you enough paraffin on the bottom and the top and the sides, but not one that it's so huge that you have just all this excess paraffin. Because when you guys get to microtomy right now in this quarter, you're only going to put one section on the side. But once you get to next quarter, you're going to put multiple sections on a slide. And so you want to be smart about the size of mold that you use. Coda, if you had grossed these where they were half this size, I could get all three of these pieces into the smallest mold size. So there would be no reason why these three can't fit in there if these were all cut into half. Okay? And then sometimes I like to try to push it and see if I can get it. And if I can't get it, then I just go back and I'll do it again and I'll get a bigger mold. And then I just don't tell anyone about how I embarrassed myself. I'm kidding. No, nobody would know. How would anybody know? Okay, we're grabbing it from the side. And now we're going. And you want to embed your pieces relatively close too. I'm checking. Cool, everything's good. And then if I wanted to pop any other bubbles, take your index finger, hold it down like this, grab it from the back with your forceps, go like that. Look at that.
Oh,
and
nice.
that gets so many bubbles out. I like that method much more than the tapping on top. Okay? And then also, you want to be cleaning up as you go if need be. So what I'm going to do now is, because this can latch onto my mold that I'm moving over here, and if it latches on, it's going to make it harder for you to move it. So I'm just going to go like this. And so a lot of times, I just clean as I go. I used to never clean as I went when I first started, and then once I started getting more further into my career, like maybe 3 months after I first started, then I just started getting a lot more caseloads, and then I just made much more sense to start cleaning as I went instead. Just do it. It's going to make a lot more sense, and it's going to make your life much easier. Okay, so with this, now we've got the punch, okay? So the reason why we have the scalpel is because in most labs, this kind of punch is actually going to be cut in half. Okay? And most of the times, whoever's grossing is going to cut it in half for you. But I've also worked in a lab where you had to go and cut it yourself at the embedding station. Some labs are like, oh, this is small enough that we don't have to bisect it, which is like where when I was at LabCorp, we didn't have to. When I was at Cascade Eye and Skin, the paths were like, no, you have to bisect it. It just depends on your path. That's who's deciding what they like. And it's not even typically who's still there, it's usually whoever was there first. Or whoever makes the most stink about it, which you'll find them out real quick. Okay, so what I like to do is I like to stabilize with my forceps and then lead with the tip and then press down. Ta-da! Super easy, super simple. And obviously they're super tiny. But look, this is the epi right here. So this is the side we want to see. So this side where we cut down, we're actually going to flip it over because you want the flattest side down as well too when you're embedding. It's going to make your life easier. So now this side, can you see how nice and flat this side is? Because we cut it, that's the cut side. Now we're going to go down like this. Okay, and then here's our epi. And do you also see how with the epi, you can actually visibly see where the epi is? It's kind of nice. Another thing too is, so you realize how we all have like all this texture on our skin, right? Like we have fingerprints and that kind of stuff. You can feel it with the forceps against the epi right here. So you actually, all of you guys take turns touching it. Here, I'm gonna get out of the way. So
Is the
you,
epi the darker part?
yes. And that makes sense too, because that's going to have the melanin in there, right?
Mm-hmm.
Oh yeah, what is that?
Whoa, where did my microtomy group go? They're hiding.
Question.
I'm kidding. What happened? No, Tobias was not used yesterday.
Go ahead, Jen.
Yeah, go ahead.
Go ahead. Jasmine, I have a question.
Feels like
I don't want to get
keratin. It's definitely tougher.
That's what I've been oriented.
Keep a walk compared to the actual like
If you wanted to.
skin stuff. It's really weird. Awesome.
Isn't that kind of cool though? That you can actually feel it?
Want me to
Yeah.
hold that so you can...
Oh,
It felt a lot like hardened leather.
As long as it's not in a station that's
wow,
being
this
used.
the skin is hot.
It reminds
Hey, no, I said not at a station that's being used. That's Michelle's. Thank you.
Getting under her
Wait,
skin.
both epithelial and
But so it'll be funny because skins, both are hard, but you can actually feel like all the lines within the
The
skin.
ridging.
Yeah,
That's interesting.
it's really interesting. Yes. Okay. Yeah. No,
yeah, I just remember.
I can
Thermos.
just give me a minute. I'm almost done with my embedding loop. Okay.
This hasn't been inked, right? That's just the epidural? Like, the skin has not been inked.
No, the skin hasn't been inked.
I mean, we would have inked it, right?
As of
If we did,
everything
yeah.
else is pink because of.
Flesh and hemoglobin, blood cells.
No, we talked about this
Oh my God.
yesterday in class. Come on, you guys. You all know the answer. And we talked about it last week during processing, and the week
Is
before during
it-
processing.
It's pink because of the fixatives.
In the eosin in the
Yes!
first station?
Heck yeah,
Wait,
Yi.
but did we eosin this?
No, we did not.
Never mind, it's in the... Okay.
It's in the process.
It is in the
yeah.
process, it's in the alcohol.
So that's why it looks like that. That's completely fine.
It's absorbed it and...
But essentially, I wanted you guys to feel how the epidermis feels so different is because a lot of times what happens is I'll be working in a lab and then they're like, I can't figure out this skin. And I'm like, oh, it's super easy. And then they're like, no, like I'm having a hard time. And then I just teach them like the little tricks that I've learned over time. It didn't take me working in a skin place to learn this trick with the epidermis. It just took me taking the time to realize it. Nobody taught me this. I just realized it on my own. Okay, and you're gonna do that a lot with yourself too. One of the tricks that I did learn in industry at my derm place that I was working at is that if you can't tell at the growth station, what we do is we will put our finger flush against it. If the specimen sticks to your finger, that means that's the internal side of the tissue. If it's not sticking to you, then that's the epidermis side because it has all of those ridges. There's less surface area for it to grab onto. Okay?
So
And they didn't give me those reasons with like the surface area and the ridges. They were just like, if it sticks, then that means it's internal. If it doesn't, it's external. And for me, like with my mind, I always just want to reason everything like you, Coda. And so that's why I'm emphasizing here's the reasons why. Because it helps. And I'm learning you guys.
so at the beginning you said from the punched biopsy is, I assume it's because larger than 3 mm, so you cut it.
Yes.
So some other biopsy, we not cut it in flat, we cut it in triangle. So generally speaking, it's larger than 3 mm.
Okay.
Do those triangle specimen gonna split in half?
No, we did this because this is a skin punch biopsy. So this is standard that punch biopsies are bisected in half.
Oh, just punch.
Yes.
biopsy.
Usually they're bisected at the growth station, but some labs will have you do it over here. And that's because when it's over there, it's a lot more flimsy, and so it's much easier to injure yourself, whoever's grossing it, as a punch biopsy over there at gross. But after it's gone through the processor, after it's gone through all those alcohols and xylenes, it's much more sturdy now. And so some labs are like, we'd rather you bisect it over here so people aren't getting hurt.
Oh.
But that was a really good question, Yi. But we won't do that with anything else other than punch biopsies that are skin or vas deferens. Or, well, obviously, because with the vas deferens, we're looking to see if a vasectomy was actually successful. We will also do it with temporal artery because what we're looking at is to make sure that the tumor did not invade into the temporal artery and is going to cause our patient to become blind. Okay? So we usually only do this with skin punch biopsies and vessels. Okay?
Bisecting.
Yes. And even with like the vessels, like the vas deferens and the artery, you're actually just bread loafing them. So you're not bisecting them in half because you still want that tubular structure. We're never going to do those in here. We don't have the tissues to do that. I would love to get the time to gross, but I don't have the time to do that. This is just for you to have in the back of your mind. So then also when you try to be smart with me and you come back after you graduate and you're like, you never taught me this. And I can be like, actually, I taught you on November 14th at almost noon. So don't talk to me like that again.
Oh,
But
we
it's
would
just-
never.
No, you will. It's okay. Everybody does it.
I
It's
will.
okay.
I'm too non-confrontational.
Okay, and now we have our molds in here. Everything's warmed up. Now I'm just going to make sure that everything is in the correct orientation. So I'm going on cut side down, and I'm doing my skin that way. Okay, and now I'm going to take my skin, and whenever I embed, I actually always embed with my epi towards me. And that's because that's just the way that I was always taught in industries. They're always like, epi towards you, epi towards you, epi towards you. And so I'm like, okay. And then I put my cassette top to the right like this after because, I put my cassette top towards the left. And that's because when I was like at my first like real histo job, we would always put our blocks to the left in the microtome. And what this does is this is going to mirror what you see over at microtomy. So this forces your epi to be pointing upwards. And I know that in lecture it tells you to point the epi downwards so you don't cut out the tumor, but I, in industry, was told you actually should have it upwards because it's the area of interest and you don't want to exhaust it. When you cut at the microtome, you're going to find out that the bottom of the block is going to be exhausted first before before we get to the top because that's the part that's hitting the blade first. Okay?
So
And every lab is going to be different. Some labs are like, yeah, you should be preserving the epi. Other ones are like, it's okay. It's dependent on the lab, and that's okay. That's normal. What I would just do is, whenever I start at a different lab, I am always just like, hey, do you have a preference as to which direction the epi should point towards during embedding? Would you like all the epi to be facing towards me or away from me?
So toward you means gonna cut first or gonna cut
It's going to
last?
cut last because it's going to be up at the top.
Toward you
But
is
it
gonna cut
also
last.
will depend on which direction do you face your cassette. If you face it towards the left and you put it down like this is now at the top. But if you face it towards this way, now it's at the bottom. Okay? And so it's a lot of mental gymnastics. So it's okay if you didn't really understand a lot of what I just said, because there's even sometimes where I'm embedding where I'm like, I want it to face the right way. I can't even remember now. And then I just stop embedding and then I'm like, okay, you know when you have those moments in life where you can actually feel yourself learning, and you can feel it in your head, and your head feels like you're like, there's too much going on right now. It's one of those moments. So I will literally just stop embedding, and then I literally will just sit there and like close my eyes, and I will picture it like, okay, the tissue is facing this direction when we're at the embedder. I'm putting my cassette this direction or this direction. I'm flipping it upwards and it's mirrored and it's on this side. And it usually, that's all it just takes, is just giving myself a little bit of space and time to stop being so overstimulated by it and to just have the moment to do it and think through it and then perform it, okay?
Question.
Yes.
In regards to all that over information, the cassette only sits in the mold one way, correct?
No, you
Okay.
can put your cassette this way,
Oh, okay.
which is what I'm used to doing because of the lab I was at for so long. But some labs are like, no, do it this
Oh, okay.
way. Yeah, so
I meant you can't flip the cassette over and put it
Oh,
in the
no.
Okay, so I guess
That's a
that's
good
what
distinction to
I'm
make.
trying to understand when you mentioned putting the cassette in a particular way and it will mirror. I guess that's what I'm having trouble
That's
understanding.
okay. So regardless of if you put it this way or this way on
Okay.
top of your mold, it's going to still mirror whatever you're doing over here. Okay? Luckily, it only matters really when you're doing skins.
Okay.
And by really, I mean that's the only time it's going to matter. Okay? So, and that's okay too, because most labs are not going to make you guys do skin. What's going on?
I just try to check. Can you? Is it the
Oh,
mold
okay, here.
in that? What's that called? The docker?
So, here.
The center. This guy.
Ah, okay, actually, look. So look. Here, watch. Sorry. Michelle. So look.
Everybody watch
So
Michelle.
if you are embedding and you are putting it down like this, then when you have it in the microtome upwards, it's gonna mirror. Okay?
I saw the slope part is toward me, so can it toward you? Like flip this guy.
Oh, hang on, you're
toward
not
you.
locked. You're not locked.
Do I have to do this one?
Oh wait, pause your time. Pause your time real quick.
I didn't start.
Oh, okay. Oh shoot. Did you guys already pull the gross log to start?
We did it. I think we're done.
Perfect. Thank you guys so much. I'm so sorry. I've been embedding all day.
When
No
offense,
offense.
you have to do this one or this one.
When you're locking it, either one, I honestly prefer this one versus that one down there. Usually the one down there is like, I'm leaving for the end of the day out, or I'm leaving for lunch.
Okay, I haven't started anything. I haven't.
Oh, you're okay. I just
Oh.
wanted them to see like this is
Michelle,
what it looks like at the microtome.
Can
'cause
this
I think this is
pointy-
gonna help you.
Pointy thing point toward adjustment? Yeah,
Is
that's
this
what I meant.
okay? Does it matter where this edge points?
No, I was gonna ask you guys as like a group what you guys would prefer to do. I just have to talk with you guys. I just haven't gotten to you guys yet today.
Yeah, that's why I
So
was.
is it like a standard,
thinking.
like a class-wide standard that we decide?
Oh wait, you know what? We have to do it to the left because night class is on left because that's what art was on.
We'll
Ah,
just do it this way.
So
Yeah,
hang on, I'll come.
that's
I
the
swear I'll
question.
be over here soon. We're almost done.
So on the topic we talk about the epi side facing down or up. I was thinking if you rotated 180 degree, that would be the derma side. The other direction would be the epi side.
No, that's why you pay attention to like which side you're putting the epi. So now, since we just remembered that everything has to be to the left, when you're at, thank you, Michelle. Now, when you're at the embedder, what you're gonna do is epi is gonna go towards us, and this cassette top is gonna go towards the left. Okay, so that when we put this up where it's like this is going to be facing up, okay, instead of down. Oh. So it'll be like that.
Would it also be, is it also smarter to have it facing up so when you go to cut the first time it won't be as hard to cut through it? If that makes sense?
You could say that, yeah. Okay, ready
So-
to embed?
In class, epi up.
Yes. No. So, yes, epi up at the microtome.
At microtome.
But at the embedder, it would be epi towards you.
Okay.
So that would be
That's
like
the mirror.
saying it's down.
Okay.
But I always just say epi towards me because
Oh.
that's how whoever was training me on embedding, Teresa would always say that. I'd be like, okay, which direction are you facing your epi? Which direction are you facing your cassette? And she'd always be like, epi always towards me, epi towards me. Just
So,
because it
if
was a
it's-
good way to have it standardized.
If it's down at the embedder, it's up at the microtome. If it's up at the microtome, it is down at the embedder. Okay.
And we're orientating our cassette
So the
to the
orientation
left.
reverses.
Yes, yes. So that's exactly how it works as like the whole mirror aspect. Is it's just switching over.
So should we always make sure in class and today the patient ID on our cassette is to the left? Okay.
So the side with the slope is to the left.
Another thing I'll do too is whenever I embed, I will always take the thinner piece and put it closer towards me because since I'm putting my cassette top to the left, that means that also since I have noticed that the blade is going to hit the bottom first and is more likely to be exhausted that way just from human use, I will actually put my smallest piece towards the bottom, like the thinnest one, so that when I get to the microtome, it's towards the top and I can help preserve it just a little bit more. Okay? I don't know why it works out this way, that usually the block at the bottom is being hit first, other than of course like the fact that that's the side that goes down first. But even when things aren't really well adjusted with the microtome and you have to adjust the chuck, which you're not learning yet until next quarter, it always works out that way as well too. Because when the chuck is adjusted, sometimes you can hit it from the top or you can hit it from the sides first, and it's usually always to the sides at the bottom that hits first. And so I just do this because I've just noticed it from years of working in industry. Nobody told me this, I do it myself. And so I'm trying to pass some wisdom to you guys. Okay, so now I've got my epi towards me and it's facing at a slant as planned. And so now I'm just gonna embed it downwards. Do you see how I'm getting all the little regions? And then I'm going to go back a little bit over the warm spot. And now we're gonna go over it again. And I want to try to make sure both get on the same plane, and that's why I'm taking my time over here and making sure that both are nice and evenly flat. And do you see how this is dripping at the end? Yeah, that's okay. Most of our stuff, and by most of it I mean 90% of our stuff in the lab is donated to us, so it's okay if it's gonna make a little trail. I know in the lecture it's like, this is bad, this is a... Nobody's gonna walk by and be like, newbie Coda. No, that would be so rude. And then whoever does it is like being mean to you, just tell me who and I'll tell you if they're actually good or not. But, so now, this is completely embedded. So do you see now how our nail is completely all on the same plane? And you can see both pieces pretty well. But this is so much extra tissue or extra paraffin right here. So we actually could have gone with one of the square molds. That's okay. So now what we're gonna do.
Are the larger sections harder to put on the water bath?
They're just a little bit trickier to cut because there's so much surface area. So I'm gonna teach you a trick with the microtome to make it a little bit easier. I keep trying to make it be a thing at my current job because they're like, everything has to be cut this way, but I like cutting bigger blocks like this because it makes it so much easier. I'm trying to make it a thing. I'm hoping me and Bella can change it because it bothers me. But here, let's go to the other side and we're gonna turn on our paraffin trimmer.
How long did you say it takes typically for once you set it on the prior console to completely solidify and explain?
I think if you were being really impatient, like maybe 10-15 minutes. Probably like 10 minutes if you're being like really impatient. But usually by the time you're done embedding everything else, like your first few rows should already be good to go. This is your block trimmer. You can absolutely grab, can you hand me that little knife behind you? Yeah.
Oh, I'm trying to.
That's okay. So you can absolutely clean off your blocks like this.
Trimmer?
So you can clean off your blocks like this with a paring knife or with a razor blade, but you can also come over here and this is your block trimmer and I'll show you how to do it, okay? Just 2 seconds and 2 ages. I'm not pointing this knife at you, you just happen to be standing there. Oh my gosh. But there's a bunch of these paring knives. There's some over there at the microtome. There's some over here at both of these embedding stations and some over at that embedding station as well too. You'll notice behind Chad that there's like some embedding troubleshooting stuff that's from your guys' stuff on Canvas that you guys can use too. So at this one where it says slides underneath on that cabinet, that one talks about how mirroring works at the embedding station. The next one over to the left is the embedding troubleshooting thing. And then next we have like the list of all the different spots, which is just what we just did, which I'll take down because the numbers might not even match up. And then next to that, we also have the embedding tissue orientation guide, which you also have on Canvas. And then next to that, and the little page protectors, you have the instructions on how to clean molds. So I would suggest also that if there are dirty molds, whoever's not embedding at the time, go and start collecting the dirty molds and let's start cleaning them, okay? Okay.
You said all these are in Google or something on high school. Yeah, Canvas.
Yes.
About 2 years ago.
So this is warming up, sorry. You should never do this. I am just checking.
And this is to just scrape off excess wax.
You want to clean off, because if you don't clean this off, do you see how there's like this residual paraffin up here? This can make it more unsteady at the top, or once you get to microtomy. And the more unsteady your block is, the more likely you're going to have issues where you could chuck out the tissue, or you could get like thick thinning, and we don't want that to happen, so we clean our blocks so that they're nice and they can fit perfectly in their little homes. We're getting there, I swear.
So that machine also need to be hot to.
Mm-hmm.
Oh, so it
But
is
so this-
melting, not
yeah.
to not like use knife to scrape, right?
Yeah, so
Oh.
look, do you see how this has like solidified paraffin right there? And you can also kind of see it's dripping off right here too. So you're gonna literally rub it across the top and it's gonna start coming down like this and drip into here. Usually what the students will do is then they'll take one of the chisels and scrape this out. Or you can pick it out with your hands like this. It's super easy too. Okay? But obviously, as you see, we also try to reduce and reuse as much as we can, and so that's why we reuse so many of these slide covers. Whew.
If we were really like tacky and wanted excess wax, could we like take some of that home for candle making? I don't know why. I just
If you want to, sure.
not really like a thing I do. It just occurred to me if someone
I
wanted
mean,
excess
last year
wax.
for Lab Week, we had a spa day, and Tiffany brought in her crock pot, and we put paraffin pellets in there, and we all would dip our hands in there
Nice.
throughout the day. It, of course, like stung, but it was really nice. Because we all would like walk around with that, and she got us like these little plastic gloves to put over our hands. Bella brought like these sheet masks, and then somebody else brought like a crock pot with like facial towels that they had warmed up, so they were nice and moist and they were warm, and then they also put essential oils on them. And so we all were sitting at our desks with our hands like this, and then with the towel over our face like this. And then, of course, at some point, then we also had our sheet masks as well too. It's very nice. Looking for ideas for lab week this year. I don't know what, if you guys have any ideas.
That would be fun, like spa day, like.
Yeah.
We did it because they were in their last quarter on campus where it's really stressful and intense. Night cohort also very much enjoyed it. They were only at like where you guys are right now. But they still enjoyed it because they were like, well, I still feel stressed out. And I was like, okay, that's okay.
Have you done restaurant or kitchen theme because of like all the tools you're working with? And you're like, yes, chef.
No, we usually will go with the theme that ASCP decides on. Last year we didn't do it.
CP.
ASCP.
Oh, ASCP. I just want to say.
You're allowed to. But so look, now I'm just cleaning it like this. You can actually, so look, so this has it here, so then I'll just angle it. And then I'll just make sure that I'm getting it. You can even go like this. Do you see how I'm using it to catch right there? You can also, I think these fit perfectly. Yep, they fit perfectly to go right here too. Just obviously be very careful with everything else. I always get super anxious that I'm going to burn myself that way, so I just go over here like a sometimes I'll even go like this. Just to get it nice and even. Also, as it's still warming up, because again, I am super impatient, especially with work. And then I'm going to clean this backside. But usually we tend to do the different themes that ASCP will vote on. They'll ask all the different community members to vote on the theme. Last year's was the mystery machine, but not everybody was super into it. Of course, Scooby-Doo was really great, but everybody was just like, well, we don't want people to feel like our jobs are such mysteries anymore. We want people to know that we're like lab professionals. So we opted to go with the previous year's theme, which the previous year was Barbie. So that's why we have a lot of Barbie dolls in the classroom. This year, I know one of the theme options is Toy Story, and I can't remember what the other one is. So it's probably going to be Toy Story, if I'm being honest, which is fine with me. Okay.
Question. I'm guessing we should never take the face that we're going to cut to the warmer, correct?
The face?
Yeah, the face.
Like
that
this
we're
part?
Yeah.
Yeah, no.
Okay.
No. People will
Don't ever
sometimes...
accidentally do that.
Sometimes people will actually... This is going back in the warmer, so I'm going to do this. Sometimes people will, oh shoot, what happened? This is fine, we can still face this away. If you were like, oh shoot, that would be a big problem. You see the
Nice
difference?
grill marks.
Yeah.
Oh my.
I'll never forget the first time I saw somebody do that. And I was just like, what the F is this? So what's it called? So now I've taught you guys how to embed. I'm gonna clean up this area real quick. Just a nice light clean so then you guys can get started. So what we're gonna do is now I'm gonna melt down the ones that I've already embedded. So I'm just going to put them in the molds they were in. And you put them on this side or this side, whichever one has the most space for you to use. Okay? Console.
Are you
We're melting them down so
so
that
Coda or whoever those belong to can use them again, or these
Not
are now just
Coda
throwing
and
away?
whoever, Coda and me.
He's important too.
Here's our multi-piece.
No, I guess what I'm asking is like, once you melt those down, we're done. We're not going to be.
Oh, with the demo, yes.
Yeah. So
Okay, so are we actually going to keep them as blocks when we do them?
Yes.
Okay,
You will
okay,
keep them. I'm melting these so that you guys can actually get the progress.
Oh, so
Here's
you
what
can
our
do them
end
again.
looks like. So do you see how it's upwards now?
Yes.
Yeah.
Okay.
So
Be very careful with the scalpel, okay? If you guys want to come over here for whoever's embedding at different stations, which I think is you two, right?
Yeah, we're over.
Yeah.
1 and 2.
If you guys want to come over for your punches and then use the scalpel over here so you don't have to transport such a giant scalpel, I would heavily encourage that. Okay?
So just try to work alongside Coda.
Yeah, just be like, hi Coda, is it possible for me to use the scalpel once you have a moment of time? And you can just carry it in its cassette and then in its secondary. Yes, that is true. But you also have E who's going to come after you too. But what's it called? Just make sure that when you do that, you keep it in the cassette. You keep your tissue in the cassette and then you have a secondary containment around it too. Okay? And then lastly, you get an hour to embed your 20 for that first lab, okay? So make sure that after you finish your hour, clean up and then tap in the next person. So Coda, let's say you're going first and then you embed all of yours in the 20 or in the 1 hour. After you do that, you clean up, like just a light cleanup, not a very deep, thorough cleanup. Just a light cleanup, like cleaning as you go. And then you're like, yee, okay, your turn to go on here for an hour, okay? Okay, do it.